a challenge to dignity. Our goal was to link academics, activists, and agencies concerned with the health of refugees and asylum seekers in a spirit of collaboration and comparison, bringing together professionals working with different populations of forcibly displaced peoples, ethnic groups, and nations. The video you are watching will contain an individual presentation edited to stand alone. We hope you find them to be of value.
All right. Our next speaker is Dr. Hans Reihling, who is a psychotherapist in private practice and an assistant professor at the Chicago School of Professional Psychology campus here in San Diego. He has also provided mental health services to asylum seekers through Survivors of Torture International. Hans's talk today is called Trauma Loops, U.S. Immigration, Detention, and Reverse Causality in PTSD.
Probably I should
Right.
put something you could text. Okay. No, I can call, but I don't know if I have to add the number before.
Right, thank you. It's been a long day with a lot of rich information, and so I'll try to go slow here and talk about immigration detention, and particularly this place here, Otay Mesa Detention Center, where I conducted more than 30 forensic mental health evaluations before the pandemic. And just want to first of all locate this place also in urban space, 25 miles southeast at the outskirts of San Diego. And it's a peculiar place where not many San Diegans would go. It's grouped together with the state prison and juvenile detention facility. And it's actually only 2 miles from the US-Mexican border. So Otay Mesa Detention Center was established in 2015 and is operated by Core Civic, a for-profit company that was formerly called the Corrections Corporation of America. And this company actually started the first for-profit private prison in the United States in the 1980s, and has since then expanded its reach also into the immigration system. And the facility has contracts with ICE and the US Marshal Service, and most of the detainees, though, are asylum seekers. So in 2020, there was an average daily population of 730 detainees with a maximum capacity of 1,142 in the facility. And I'm also, in a minute, I'm going to say a little bit more about how this changed in the wake of COVID-19. Average stay has been like about 3 months, but I have also worked with detainees who had to stay there for much longer than a year. And this practice of immigration detention is relatively new historically, and it started in the 1990s, and especially after the Illegal Immigration Reform and Immigrant Responsibility Act was passed during the Bill Clinton administration. And in that act that is now part of Title VIII, there's it specifically stated that people who wait for their court case, they shall be detained. And we know it's not always applied, but it is often for so-called arriving aliens who come to the border. At least it was that was the case pre-pandemic. And so, and another impact was the Homeland Security Act. And I would say, like, immigration detention must really be seen in the larger context of the US prison industrial complex and the criminalization of immigrants. And if you look at the numbers since the 90s, the number of detained asylum seekers constantly, or immigrants, most of them are asylum seekers, went up to 50,000, I think, even like in 2019, up from 5,000 or 6,000 in 1994. And since the pandemic started, the numbers went down. These are the figures from Otay Mesa Detention Center. At the beginning of last year, there were 700 detainees, went down, and right now, like, there are even less people in there. One would think it's a good thing, but it's actually not, because like during the past year, like more than 1 million people have been denied the right to asylum when coming to the border under Title 42. So what's the significance of these forensic mental health evaluations? So asylum seekers have very slim chances of actually succeeding at court. About like 90% of applicants who don't have an attorney are denied. And this means that it's really important to have legal counsel, and attorneys always seek for evidence in the face of, often not having much at their hand. So a mental health evaluation has become actually a sort of a biopolitical capital that can be used to get asylum. And although the right to asylum does not depend on a mental health diagnosis, such diagnosis enhances the chances of success at immigration court. So aid organizations and their attorneys recruit mental health clinicians to evaluate their clients in the hope of establishing credibility. And immigration judges use these evaluations to determine the credibility of the asylum seeker's narrative. Doesn't mean that if somebody has an evaluation and is diagnosed with PTSD also gets asylum, but the chances are much higher from everything that I have heard from attorneys that I've worked with. So now I conducted 32 of these evaluations at Otay Mesa. And usually an evaluation includes a semi-structured interview, and people go through the Hopkins symptom checklist and the PTSD checklist for DSM-5. And all of the people that have been referred to me, almost all of them, like 31 out of 32, met DSM-5 diagnosis, a diagnosis for PTSD, and almost all of them also for major depressive disorder and generalized anxiety disorder. And here I have a picture of DSM-5, just also to point out that this is a cultural artifact, and which has like certain ideas around how PTSD works. And the main idea is to establish a link between a past event and current mental health symptoms. And I'm going to get to that in a moment. So there are the different criteria: the exposure to the traumatic event, intrusion, avoidance, alterations in cognition and mood, arousal and reactivity. Those are the main ones. And usually they can be seen in this linear sort of model. So this model is based on an idea that memory could basically be stored in human beings, like just like on a disk or a hard drive, and it's just in there. And from there later on, these re-experiencing symptoms and flashbacks come up, and then also the rest of the symptoms. So current circumstances or events are blended out in favor of a past etiological event. And a lot of mental health clinicians know that this is not really how it works, because memory is more complicated. And I see it as a sort of a looping where the current circumstances can actually provoke these re-experiencing symptoms and lead to new traumatic experiences depending on what's going on in the environment. And in the context of detention, traumatic memories that might have had mild effects on a person or no effects at all might be triggered during detention. And a lot of the detainees I talked to, they tried to do something about that. And they wanted to basically not remember and not have these negative intrusive thoughts. So what they did was they signed up for so-called volunteer work with Core Civic. And I'm going to present a couple of quotes now. So I have here a transgender woman from Honduras. And she said, "I wasn't able to feel happy since I came here. I like to dance and I like to listen to music. I like to socialize, but I don't feel like doing it here. When I sing, it makes me feel better and I forget about the past. But then the guards come and tell me to stop. I don't understand why. I always like to sing, it relaxes me, but here I can't. I can't even get a hug from my trans friend because it's prohibited. That makes me sad. When I go out, I'm always alone. I don't communicate because I'm afraid of man." And you see here like some of the experiences she had in her home country. "And sometimes I clean the floor," she said. "I wanted to be occupied with something. I wanted to do something during the day, and I thought if I had work, I could distract myself. But they put me on night shift. I clean the floor from 11 p.m. to 12 a.m. And I'd sleep longer if I didn't depend on the schedule. When I wasn't working, I would go to bed at 10. I would sleep at 11 and get up at 5 for breakfast. I started 2 weeks ago with the work, and since then, I'm not having breakfast anymore. I feel like I'm losing weight. For 1 week, I haven't been eating breakfast." This is one example of an experience, and another one here from a 35-year-old cisgender man from Anglophone Cameroon. And he had a bachelor's degree in his country. And he said, I signed up to clean the bathroom 5 times a week to keep myself busy and not think about Cameroon. The main reason is to keep myself from thinking about the past. When I started working, I was not thinking of money because it's not money for me in comparison to what I made as an accountant in Cameroon. I work 5 days a week and they give me $5, but the check is actually $4. We don't look at our hours because we just want to keep ourselves busy. A lot of people who do that job think like me. My salary was more than $1,000 as a consultant, and I was fine. I wanted to build my own home. But here, cleaning is a good thing because it keeps me busy. You're not thinking negatively only if the toilets are not flushing and there's a big mess. Sometimes I get very disturbed when people are not cleaning after themselves. When I see the toilet that's not flushing and it's full of feces, it reminds me of the torture back in my country. And this was a man who was put into a bucket of feces and urine to simulate drowning. So I have more of these stories, but basically they speak to the conditions at Otay Mesa Detention Center and the sort of labor exploitation that takes place there. This other vignette would be about a man who felt he had to earn some money through this program that they provided in order to buy food from the commissary, because he said you can't really eat that food. The food is pretty bad. So he had to work to get some noodles from the prison shop. So these are the type of conditions. And
2 minutes, Hans.
okay. And recently, even ICE found violations of its standards in the facility. They didn't point out the labor exploitation and the problems with access to medical care, but they did point out problems with the facility not enforcing COVID-19 guidelines and some other problems. Now, interestingly, since the pandemic, the numbers dropped, but ICE has a contract with CoreCivic and guarantees to pay for at least 750 beds. Now, the detainee population went down, and you see here in April 2020, an average cost, daily cost was $186. In March 2021, it was $339. Because, at that time, there were I think about 400 detainees. And I have some more information here about the COVID response in the detention center. It was last year when the first COVID-19 death in U.S. immigration detention occurred. And the person, the man, 58-year-old Carlos, Mejia, he actually fled El Salvador in the 80s, and he had been in the United States for a while, was detained, and the beginning of the pandemic, he was protesting against the CoreCivic's COVID response. He went on hunger strike because they didn't provide testing. There were problems with actually isolating people who had symptoms. They wanted people to sign releases in order to get masks. So he participated in a hunger strike. He was put in segregation, which means solitary confinement. And then later found, like, yeah, he had COVID-19, and then he was released and taken to Paradise Valley Hospital, where he eventually died on a ventilator. So this is my alarm at my 20 minutes. Thank you for listening, and hope you have questions for me. I didn't get to the alternatives to detention, but please.
Hi, thank you very much. Could you talk to us about alternatives to detention?
And also a little bit more about the COVID-19. There you go. We gave you the opening to
Okay.
say the rest of what you wanted to say.
I mean, there are some stats here about COVID-19. And, you know, like this is a picture also from, like I'm going to do one after the other. That's a picture that was taken by a guard through the surveillance camera, and in February 2021. And you see here that obviously, like, masks were not enforced, social distancing was not enforced, and eventually ICE found out, and they're now finding the facility for it. So, and there's more to say about that, but when you think about alternatives to detention, there was this really interesting study, like in the 1990s, when the Vera Institute of Justice demonstrated that people who are just able to be in a community environment and participate in this appearance assistance program, they were actually more likely to appear at court than the people on parole or on bail. So most of the people, they actually showed up. So they said, like, what's the point to detain all these asylum seekers? And obviously the government didn't really listen because the number of detainees went up. But the idea of alternatives to detention was taken up. And it was put in the hands of another private company, different private companies. One of the biggest ones is the GEO Group with its behavioral interventions program that is responsible for the surveillance and monitoring of people who wait for their trial through all these different methods with the Smart Link, that's like through the phone and taking the photos, and the GPS monitoring and so forth. And the surveillance is actually increasing. So in the fiscal year of 2020, there was an allocated 149 million for this type of surveillance. Now for 21, it's a 440 million. So you see, like, there's heavy investment into these technologies, And just one more thing I wanted to share here in that regard is the experience of a man who had the ankle monitor bracelet on his foot for about 2 years, and it was malfunctioning, and it was going off at night over a period of time, several times. And each time he could feel the ankle monitor go off, he would have traumatic re-experiencing symptoms, and it was horrible for this man. He got some treatment, psychiatric treatment, and he was part of a man's group with Survivors of Torture International. But it was a situation. We couldn't do much for him because he would go to ISAP, that's a program, and report that what's going on, but nobody believed it. And he said, they're just not listening to you. And I had this, I heard the same thing from other survivors. And if you look at it, I mean, on average, there's one case manager for 125 participants in the program. So I'm going to stop here. And, actually, I had some concluding thoughts also. So, but I can leave that open, or if you want to hear them, I can add them.
Well, do we have any questions other than asking you to tell us your concluding thoughts?
I do have one question for you. Thank you so much for your presentation and the work that you're doing. The Tacit Project has been collecting a lot of data on provider well-being, and one of the themes that has come up is a stronger connection between legal services and psychological services due to psychological evaluations being such a big part of the asylum process. I'm wondering if you agree, and if you could speak about how we can improve this process on top of, dismantling MPP and no longer requiring detention.
Yeah, I think it's key to collaborate with attorneys, and actually Survivors of Torture International has a yearly provider meeting where immigration attorneys, mental health clinicians, and medical doctors come together and talk about the latest developments. And I mean, it's key for us also to know what's going on the legal side, what kind of information they need. So yeah, it's a good point. And I think it's really important.
There's a comment.
So yeah, I just want to say more research is needed to understand how present moment embodiment determines the course of post-traumatic stress after torture in the US immigration system. And the post-traumatic is really often a misnomer for what's going on with the people in the system.
I just have a final comment here from another panelist, Kristen Yaris, who says the violence of these forms of body restraint like ankle monitors is important to address. The degrees of carceral care and punishment, surveillance from total control inside the detention facilities to these remote forms of surveillance by app or foot monitor are so important to understand the trauma loops you are describing. And she thanks you for the presentation.
Thank you for the comment.
Can I add one thing, please? Can I add one thing?
Okay, last comment.
I had a client who had an ankle monitor. He's from Jordan, and he used to wear pants, make sure it's covered, because he said, this is very embarrassing, shameful. I look like a criminal. I did something wrong. I'm not a criminal. All this stuff. And he comes from a good family in Jordan. And he was like, this is so traumatizing for me. He always had a hard time about it. And he was talking to me about it. And he didn't know if he was going to say or not. But the ankle monitor, I agree with you, was devastating for him.
And we have patients, they're terrified to just go to the office and getting that ankle monitor. They think they're afraid of getting it. And yeah, so lots to
They
say
think
about
they're
it.
criminals, right?
Thank you.